Premier Doug Ford confirmed Ontario is in a second wave and warned it will be worse than the first one. How much worse, he says, depends on Ontarians.
What we don't know yet is how bad the second wave will be. The reality is, it's up to each of us. Together, our collective actions will decide if we face a wave or a tsunami.
The government appears to be bracing for the worst, today putting out a call for more enforcements for the front lines, nurses, PSWs, and caregivers.
We need more healthcare professionals. Your province needs you right now.
$52 million will go to hire and train close to 4,000 new healthcare workers, with a $5,000 incentive to recruits if they make a 6-month commitment. This was never done during the first wave. A senior government source says it's to plug the holes in the system. During the first wave, long-term care buckled under the strain with 1,800 residents dead. This wave is impacting more young people, and hospitalizations have been low, but are creeping up. The chief medical officer of health believes it's going to get worse.
As always, these large numbers, the hospitalizations follow about a week to 2 weeks later.
And that is the fear, overwhelming hospitals. Today, the Ontario Hospital Association called for the province to put Toronto, the GTA, and Ottawa back into stage 2. This was the health minister's response.
We don't want to turn back a stage unless we absolutely have to, but if we do have to, we will.
The chief medical officer of health did not say what level COVID would have to hit to push regions back to stage 2. Dr. Williams says modeling shows 2 different possible outcomes. The first, a tsunami-type wave that would sweep through the entire province with between 3,000 to 5,000 new cases a day. The second possibility is an undulating wave that rises and falls. He believes that is what is occurring now and needs to be taken seriously.
This is a wake-up call for us. We have to pay attention.
Health officials say this is a different battle than 6 months ago. Before, COVID-19 was spread right across the province. Now it's in concentrated areas like Toronto. And the positivity rate is much lower. At the peak in March, April, it was at 8.5%. Right now, it's hovering around 1.3%, higher in Toronto at 1.9%. That's why the chief medical officer of health says he's not hitting the panic button, at least not yet.